It's wild to think about, but our own immune systems are like powerful forces against cancer,
Yeah.
like constantly on patrol.
Yeah,
An internal army, right?
absolutely.
Just like any army, sometimes it needs, backup.
Right.
So today we're going deep into the world of immune checkpoint inhibitors. It's a newer approach to cancer treatment that's showing some seriously incredible promise.
It's very exciting.
It is exciting.
Oh,
And we're going to break it all down for you today, right?
we are.
Think of this deep dive as like your cheat sheet
Okay.
to understanding how these therapies actually work.
Yeah.
And specifically, we're going to unpack 3 types: anti-CTLA-4, anti-PD-1, and anti-PD-L1.
Those are the big ones.
Yeah, those are the big players, right?
Yeah.
Okay. So before we get into the, the nitty-gritty of
Right.
each type,
Yeah.
let's zoom out for a second.
Sure.
We know our immune system can fight cancer cells,
Yes,
but they can be pretty sneaky, right?
they are very tricky.
They got their tricks. So tell us a little bit about this whole immune evasion thing. How do cancer cells slip past our defenses in the first place?
So it's really interesting. They're actively evading the immune system.
Wow.
Like they're playing hide and seek. Imagine your immune system has brakes to prevent it from going into overdrive and attacking your own body.
Okay.
And cancer cells can actually exploit those natural brakes to put the immune system on hold and prevent it from actually doing its job.
So it's like cancer's hitting the brakes on our immune cells.
Yes.
And these checkpoint inhibitors we're talking about today are like cutting the brake lines.
Yes. That's a great way to put it. It's like restoring the balance. It's allowing the immune system to work the way it should, but not cause widespread damage to other places.
Okay. I'm starting to really see the potential here.
Yeah.
So let's talk about these brakes being released, right?
Okay.
First up, anti-CTLA-4. What's the story with this one?
So anti-CTLA-4, it was actually one of the first immune checkpoint inhibitors to really show promise in cancer treatment. And it specifically targets a protein called CTLA-4, which is found on T cells.
Okay. Now hold on for a second.
Sure.
For those of us who haven't been to med school lately,
Yeah,
remind us, what are T cells exactly?
of course. T cells, think of them as the special forces of your immune system.
Okay.
They're the ones that are responsible for actually seeking out and destroying any threats, including cancer cells.
Gotcha.
But they need to be carefully controlled,
Right.
which is where CTLA-4 comes in.
So CTLA-4 is kind of like a control switch
Precisely. Yes.
for the T cells.
In a normal immune response, CTLA-4 makes sure that the T cells don't overreact.
Okay.
But cancer cells can kind of manipulate CTLA-4 to their advantage.
So, yeah.
They're basically hijacking the control switch and keeping those T cells from doing their job.
Wow. So anti-CTLA-4 swoops in and blocks that manipulation from happening.
Yeah.
It's like giving our immune systems back the controls.
That is a great analogy. Yeah, by blocking CTLA-4, these therapies release the brakes. And then the T cells can function at full capacity and eliminate those cancer cells.
That's really incredible.
That's really remarkable.
Are there any specific examples of anti-CTLA-4 therapies that have been, really successful?
Yeah. So one notable example is ipilimumab, and it's been incredibly successful in treating advanced melanoma.
Melanoma, that's a serious one.
Absolutely. It was actually one of the first therapies to actually show a survival benefit in patients with advanced melanoma.
Wow.
And it's not limited to just melanoma. It's also being used oft in combination with other therapies for treating renal cell carcinoma.
So it sounds like this combination therapy might be a recurring theme here.
It very well could be. It's definitely an area of active research because, sometimes combining different checkpoint inhibitors or even combining them with more traditional treatments enhances their effectiveness. We'll kind of get into that a little bit later.
This is fascinating stuff. Okay. So we've got anti-CTLA-4, boosting the T cell's ability to fight the cancer.
Right.
Now let's move on to another key player. Anti-PD-1. How does this one fit into the picture?
So anti-PD-1 therapy, it works a little differently than anti-CTLA-4, but it's also focused on, that T cell activity.
Okay.
And so PD-1 is another protein that's found on T cells. And you can kind of think of it as an off switch.
Another break on those powerful T cells?
Exactly. Just like CTLA-4.
Okay.
Tumor cells can exploit PD-1
Oh, no.
to their advantage, again, being sneaky.
Of course.
They do this by producing a molecule called PD-L1.
Okay.
And what PD-L1 does is it actually binds to PD-1 on the T cells and basically shuts them down.
It's like they're waving a white flag, like, we surrender.
Yes.
But it's all a trick.
Exactly. It's just to disarm the immune system.
To disarm. Wow. They really are adaptable.
They are.
Cancer cells, I mean.
Yes. But luckily, so are researchers.
Okay, good.
This is where the anti-PD-1 therapies come in.
So they're designed to kind of see through that trick.
Yes. They block that interaction between PD-1 and PD-L1, so preventing that off switch from being flipped.
Gotcha.
Which then reactivates the T cells and allows them to see the cancer cells and do their thing.
Wow. It's amazing how these, like, tiny little molecules can have such a huge impact.
Huge.
On our immune system's ability to fight this disease.
I know. It's incredible.
Are there specific anti-PD-1 drugs that, we should know about? Ones that are really, making a difference in people's lives?
Absolutely. Two that come to mind right away are nivolumab and pembrolizumab.
Okay.
And they've both been approved for treating a bunch of different types of cancer, actually, including melanoma, lung cancer, even Hodgkin's lymphoma.
It's pretty incredible to think that we're at a point where we can, manipulate these really intricate mechanisms within our bodies to fight disease. And it makes you wonder, are there even more of these immune checkpoints that we could target in the future?
That's a great question, and I think the answer is yes.
Right.
There's so much research going on exploring other targets for immunotherapy. It's such a rapidly, evolving field.
Wow.
Yeah, and, one promising area is developing therapies that, target multiple checkpoints at the same time.
Oh, wow.
So, for example, combining anti-PD-1 and anti-CTLA-4 therapies has shown some really, really cool results. You see more, robust and long-lasting responses for some patients.
So it's like we're finding the right combination of tools
Yes.
to really, fine-tune that immune response.
It's like precision medicine.
It is. Okay.
Right.
But before we get too far ahead of ourselves, what about anti-PD-L1?
Right.
This is the third type of checkpoint inhibitor we're talking about today.
Yeah.
How does that one differ from the others?
Okay. So remember how we were talking about the tumor cells producing that PD-L1 to disguise themselves?
Yes.
From the immune system? Well, anti-PD-L1 therapies, they kind of take a more direct approach.
Okay.
So instead of targeting the T cell's PD-1 receptor, they target PD-L1 itself.
So instead of blocking the off switch on the T cells, it's like they're ripping off that disguise
Yeah.
that the tumor cells are wearing.
By blocking that PD-L1, those cells, they can't hide anymore.
Wow.
They're vulnerable then to attack from those, newly reactivated T cells.
That's amazing. So it seems like this anti-PD-L1, it's directly targeting that tumor strategy.
It is.
Of evading the immune system.
Yeah.
Does that mean it's more effective than anti-PD-1?
That is a great question.
Yeah.
And, it's not necessarily about one being better than the other. They work in different ways, right?
Yeah.
And different cancers respond differently to each treatment.
So it's really about, understanding the specifics
Yes.
of that patient's cancer.
Absolutely. It's like finding the right tool for the job, right?
Right.
Some cancers, they have a lot of that PD-L1 expression, which we talked about.
Right.
And that might make them more responsive to those anti-PD-L1 therapies.
That makes sense. So are there specific anti-PD-L1 drugs that we should, be aware of?
Yeah, there's a bunch.
Okay.
Atezolizumab, durvalumab, avelumab, just to name a few.
Right.
And each one has been approved for treating specific types of cancer. You're talking lung cancer, bladder cancer, even a really rare skin cancer called Merkel cell carcinoma.
It's incredible, how far we've come
I know, it's amazing.
in developing these, super targeted therapies.
Yes.
And the research just keeps going.
Oh,
It's
good.
evolving so fast.
It is. It's really remarkable.
So what's next for immunotherapy? Are we on the verge of even bigger breakthroughs?
We are. And I think one of the most exciting areas is the use of these biomarkers.
Yeah.
And these are basically clues. They can help us figure out which patients will benefit most from these specific checkpoint inhibitors.
Biomarkers. So we're talking about personalized medicine,
Yes.
but for cancer treatment.
Exactly. It's personalized medicine for cancer, which is really cool.
That's fascinating. So what kind of clues are we talking about? Give me the details.
Okay, so one really important biomarker is that PD-L1 expression, which we talked about.
Right.
So some tumors just have a ton of it,
Okay.
which could mean that they're more likely to respond to those anti-PD-L1 therapies.
So by testing for that, doctors can be okay, this is the best route to go.
Yes, it takes the guesswork out, right?
Right.
You can say, this is going to be the most effective treatment for you, and you're minimizing all those potential side effects that you don't need.
Right.
And it's not just that one. Another one that we're learning more about is tumor mutational burden.
Tumor mutational burden. Okay, you're gonna break that one down. What is that, and how does it play into all of this?
Okay. So TMB, it basically refers to the number of mutations or changes in a tumor's DNA.
Oh.
You can think about it as like how different the tumor's genetic makeup is from the patient's normal cells.
Okay, so more mutations means what? Does that mean that the cancer is more aggressive?
It's not necessarily about if it's more aggressive. It's not just the number of mutations. It's the type and how those mutations actually affect the tumor.
Okay.
Because some mutations can actually make the tumor like more recognizable to your immune system.
Oh, so a higher TMB could mean that the tumor is more likely to trigger an immune response.
Exactly.
So it makes it more vulnerable to these checkpoint inhibitors.
Yes. And studies are showing that patients that have a high TMB, they tend to respond much better to those checkpoint inhibitors, especially those anti-PD-1 therapies.
Wow. That's really remarkable. So we're basically talking about using the tumor's own genetic makeup to predict how it's going to respond to treatment.
Exactly.
This feels like we're entering like a whole new era.
A whole new era of cancer treatment.
It really does.
Hey, you know what? As we learn more and more about these biomarkers, we'll be able to personalize it even more. Pick the best therapies for each patient, get rid of all those unnecessary side effects.
Right. It all sounds incredibly promising.
It is.
But I have to ask, are there any downsides to these checkpoint inhibitors? Because it almost sounds like, a little too good to be true.
It is important to be realistic.
Yep.
Just like any cancer treatments, they can cause some side effects.
Okay, that makes total sense.
Yeah.
So what kind of side effects are we talking about here? What do people need to know?
Well, we were talking about how those checkpoint inhibitors kind of take the brakes off the immune system.
Right, yeah.
Well, sometimes that means that it can get a little overactive.
Okay.
And start attacking, not just the cancer cells,
Oh.
but healthy tissue too.
So it's a powerful weapon.
Yes.
But it needs to be aimed carefully.
Exactly.
At the right target.
Yes. They're called immune-related adverse events. Or IRAEs, we call them.
IRAEs.
Yeah. And they can affect a bunch of different organs.
Okay.
So you can see inflammation in the skin, the gut, liver, even the endocrine system.
Okay. So how common are these IRAEs?
Yeah.
And how are they managed if they do happen?
So most of them are mild to moderate.
Okay.
And we can usually manage them with medication.
Okay, good.
And, researchers are always working on better ways to predict them, monitor them, and manage these side effects.
That's good. It sounds like the benefits, especially when we're talking about, long-term survival for patients, often outweigh the risks.
They really do. But it is super important to just have these really open and honest conversations with your doctor,
Right.
about the risks and the benefits so you can make the best decisions for you.
Absolutely.
Mm-hmm.
Definitely sounds like the future of cancer treatment is really moving towards this whole idea of harnessing the power of the immune system.
It is.
It's amazing to think that we're not just fighting the disease.
Right.
We're retraining the body to fight for itself.
It's a totally different way of looking at it. It's really cool.
It really is. It's like we're figuring out the code. And you know what?
Yeah.
It makes me wonder, could this approach, this immunotherapy, be used for other diseases too?
Absolutely. I think, the possibilities, they're kind of endless.
Right.
We're talking about everything from autoimmune disorders, where your immune system is attacking your own body,
Right.
to, infectious diseases like HIV, the flu. I mean, if we can figure out how to reprogram it for cancer, who's to say we can't for other things too,
Yeah, that's pretty mind-blowing.
It's pretty amazing.
It really is. Instead of treating the symptoms, we could be training the body to fight the root cause
Exactly.
of so many different diseases.
Yes.
Wow. Well, we've covered a lot of ground today.
We have.
From, the different types of checkpoint inhibitors and how they work to the future of this entire field.
Right.
It's been incredible. What's the one big takeaway you want our listeners to remember about immune checkpoint inhibitors?
I think the biggest takeaway is they're already changing how we treat cancer.
Yeah.
And they have so much more potential.
Right.
This is definitely something to keep your eye on because, it's just the beginning.
The beginning. I love that. Well, thank you so much for joining us on this deep dive today.
Thank you for having me. It was fun.
It was really eye-opening, honestly.
Good. I'm glad.
And to all of our listeners out there, thanks for, coming along on this journey with us into the world of immunotherapy. If you want more information, you know what to do. Check out those show notes. Until next time, stay curious.